Welcome to Maternity Nursing 1 with Miss Kinnan. I'm presenting today the PowerPoint from Miss Joyce about physical assessment of pregnant women or an antenatal care. The objectives of these slides are to explain to you about the tools that you can use in ANC assessment. You will be able to calculate the last menstrual period, or what we call LMP, then estimated due date, the Leopold and McDonald maneuver, fetal heart rate counting, and as well as introduce to you the format of physical assessment on pregnant women. So what is ANC? So ANC is what we know as antenatal care. So this is the service we provided to the pregnant women during their pregnancy. As nurses, we do the physical and psychological health monitoring, including the fetal growth and development, as well as to prepare the woman for labor and birth. The purpose of ANC actually that we want to ensure that the pregnant women go throughout their pregnancy, labor, and postpartum period with safely and deliver the baby healthily. In ANC, every pregnant woman needs to at least visit 6 times during the antenatal period. So in the first trimester, we hope that they visit the clinic or do the checkup 2 times, at least within their 12 weeks of pregnancy. And on the second trimester, during the 13 to 27 weeks of pregnancy, we hope that they visited at least 1 time. And on their last or the third trimester, we hope that they will visit the clinics and check about their pregnancy around 3 times. So this will happen during the 28 to 40 weeks of pregnancy. These are the tools that we use in ANC to examine our patients, such as you can see here we have the weight scale, we have the height measurement, we measure their temperature, we use to measure the heart rate and the respiration rate of the mother. We use the Doppler, we use the Linex, we have the stethoscope and the sphygmomanometer to measure their blood pressure, as well as we check their pupils, their eyes, and also the color of their vagina, and we check the reflex on their patella, as well as we measure the upper arm circumference, as well as also we provide privacy when we are doing the procedure, so we also can cover the feet and the tummy with the blanket. Now we move on to what we call the obstetric status. So we know it as a GPA, or some books we call it a TPALM. So T stands for term, P for parity, or how many child they deliver. A stands for abortus, L stands for living, and M star is for multiple gestation. So, but this time I'm going to explain about GPA. So GPA stands for gravida, para or for P, and then abortus for A. So G is how many pregnancy the mother had, and then P is how many has the mother given birth either vaginally or C-sections, and it can be premature, mature, or postmature. So remember that premature is within 32 to 36 weeks, mature is 37 to 41 weeks, and postmature is more than 42 weeks. And the A is actually the number when the mother had an abortion, could be normal abortion or induced abortion, depends on the case of the mother, or it can be also complete and incomplete abortion. So the example that we're given, that this mother now recently pregnant, never given birth, and never had miscarriage, so it will be G1 POAO. And when the mother is pregnant, she had one time abortion, and then now is the first child is already 3 years, so then we have to say it's the gestation is 3, with 1 time of party and 1 time of abortion, because this is the third time she had been pregnant. So if the mom then is 36 weeks pregnant, she had 2 normal delivery, 1 um, surgery or SC or CS surgery, but then never had abortion. So we can write that this current pregnancy is the 4th pregnancy with 3 parity or delivering baby through normal and C-section, and never had abortion. So it's AO. Now, we are going to also learn about the last menstrual period, or in Indonesian, we call it hari pertama haid terakhir. So, we used to ask this to the mother to determine when is their due date. So the first day of last menstrual period is actually the first day of your last menstrual period. So you had period last month, and when is the first day of the start of your period? So by knowing the LMP, we can find out whether the woman has a gestational age that matches the delivery or not. For example, the mother um, actually gets her period on August 1st, 2020, and the ovulations occur approximately 2 weeks after that date. And in September, the mother does not have period because she's positively pregnant. So we are going to say that her LMP is set for August 1st, 2020. And here is the calendar. So this tools is the one that we use to estimate not only the last menstrual period, but also when the baby is going to due. So once you have here is the first day of last period, then we assume that the conception's happening 2 weeks, and then by the week 4, the mother will miss the period, which indicates that the mother is pregnant, and we will calculate on when will be the estimate or possible probable date of birth of the baby. So could be on week 40, could be on week 36. So these are the period when the baby is term. So let's say if the mother does not remember which exact date, but it probably happened on the 1st June, then the estimated due date will be around 7th or 8th of March the next year. Alright, so we'll learn about that more in your clinicals lab. Now, how to calculate the estimated due date or EDD? We call it in Indonesian tansiran persalinan or hari perkiraan lahir. So using the Nagel formula, but this applicable to women with the regular 28 days of menstrual cycle, we use to count this. If it's like the first day of the LMP is during April to December. To the date, we ate 7 days. We minus 3 months to the month, and then we added 1 year because it will pass December and it will be the next year. If the LMP is in January, February, and March, we just may plus the date with 7 and then the month with 9, because it won't go to the end of the other year, because it's 9 months. So let's say if the estimated due date for the LMP on August 1st, 2020, so it's 1 plus 7, so it's 8, and then 8 minus 3, it's 5, so it's May. So it will be on 2020 plus 1, 2021. So it will be 8 May 2021. And if the LMP is on January 15, so you will have to add 15 with 7, so the date will be 22nd. And then the month would be 1 plus 9, so it will be around October 22nd. 2020. So that's how we calculate the estimated due date. Next one, we'll talk about the Leopold maneuver. So in Leopold maneuver, you have four steps. The first one is to determine the gestational age based on the uterine fundal height and determine the part of the fetus that is in the fundal of the uterus. So the examiner will face the mother and the mother will flex her leg, and then the bladder must be empty, and then you will try to locate the fundal height and then try to see what's the part of the baby that is there with your both palm. You will have to recognize, is it round, is it large, is it soft? If it's like soft, it's probably the buttock. If it's round, large, and hard, it could be the head. If it's like longitudinal, like long and resistant, it's probably the back. And if you can touch like the small part of the babies, then it means probably this is the extremities facing. Well, in the term pregnancy with acephalic presentations, this Leopold 1 will reveal that it's a round, large, and soft buttock area. So we have to measure the fundal height of the mother. So from the pubic symphysis, we are going to measure the fundal height from here up there to determine the length of the fundal height. Now, after that, we move to Leopold 2. So in Leopold 2, we determine the boundary, the line of the uterus. We also determine where is the locations of the fetal bag. Is it on the right or in the left? And we also try to hear the fetal heart rate. So examiner refaces the mother and then palpate the fetal part located on the right side and the left side of the uterus with both hands. And then if it's the term pregnancy with head presentation, then you will have the elongated part or the back on the side and on one side, and then on the other side will be the smaller parts for the extremities. Next, on Leopold 3, you are going to determine what part of the uterus is at the bottom here, and then you will have to see whether the head is actually entering the upper pelvic door. So examiner faces the mother, you have to palpate the part, the fetus located on the symphysis pubic with the other hands, but then the other hands also fixate the fundal height so we can see where's the baby. And then we have to then determine whether it's like down here is the large soft or large and round and hard, and we have to also palpate the elongated back or the small parts which indicates the extremities. In the term pregnancy with head presentations on Leopold 3, we have to be able to palpate the round, large, and hard, which indicates the head. And if it still can be shaken, it means that the fetal is not entering the pelvic door yet. The next one is the Leopold 4. You're going to determine which part of the fetus is located below and determine how much of the fetal head has entered the pelvic gateway. So examiner faces mother's leg. The mother's leg are being asked to be straight, and then you determine where's the bottom of the fetus, or is the fetus part, the head is already entered the pelvic way. And then you have to wailing off the bottom of the fetus to see if it's like convergent, or is the if the bottom of the fetus has not entered the PAP, or is it a line has partially entered the PAP, or is divergent that the bottom of the fetus already entered the pelvic gateway. Now, we also learned about the McDonald's examinations technique. So this is how we calculate the gestational age by the um, fundal heights. So this can be compared to the result of the LMP. So if the fundal heights, so what we do is the fundal heights times uh, 2 per 7 to determine the gestational age in month, and fundal heights times 8 per 7 to determine the gestational weeks of the mother. So if the fundal height measurement is 24, then what we do to know the gestational age in weeks is that we have 24 times 8 per 7, so it's 192 divided by 7, so it will be around 27.4 weeks. Now, this is actually the how we normally recall the fundal height. So at 12 weeks, the fundal will be just up the symphysis pubic, and then when it's like 36 weeks, it's actually right up the sternum, and then when it's 40 weeks, it will be dropped a bit because some parts has been down into the pelvic. So we have to determine the heights of the uterine fundal, estimate gestational age based on certain parameters, the umbilical, xiphoid processes, and upper age of the pubic symphysis. So here, the pubic symphysis. So this, as you can see, the small uterus, and then going up as the baby grows. On around 20 weeks, it will be around your umbilical. Then you will have like um, max when at 36 weeks, it will reach the xiphoid processes. And then after lightening, or when the baby enters the pelvic inlet, then it will be down a little bit. So this is how we measure from the pubic symphysis through the fundal height. So this is the chart, so you can see it later, and this is how it is also the top of the pubic bone to the top of the uterus. So we count the fetal heart rate. The fetal heart rate is being counted using two machines, the Linac and the Doppler. So it will be done to reference the monitor maternal health and fetal development. At 12 weeks, it can be heard through Doppler. At 16 to 20 weeks, it can be heard through stethoscope. The normal fetal heart rate is 120 of 260, and we count it for full 1 minute. And then when it's heard, we compare it with the mother's pulse. So normally the faster fetal heart rate, it has to be faster than the mother's heart rate. Next one is we can use a periodic auscultations, as I mentioned before, the Linac and the Doppler, such as the fetoscope. So this is Linac fetoscope, and the Pinart stethoscope, and as well the Doppler ultrasound stethoscope. So this one. And we also can measure it continuously through the electrofetal monitoring. So we have one's transducers that sensing the uterine contractions, and one sensing the fetal heart rate. So this is what you do. You have the transducer for uterine contractions, and then you have the transducer to sensing fetal heart rate. Then you have the monitor, and then you have the graph paper that will then show you the contractions and then the baby heart rate. Now, moving on to the assessment, we move from the head of the patients. We see if the head is symmetrical, clean hair, is there any hair loss, masses, or pain on the head. Then we see the face, is it pale, edematous. We see the eyes, is the sclera discolored for anemia, is anemia under conjunctiva, is there is any chloasma for the nose, and if it's tender and clear, is there any polyps, any masses. On ears, is the ears symmetrical, tender? On mouth, is the mouth pale? On teeth, is there any cavities or caries? On neck, we see if the thyroid glands is enlarged. On the chest, we see if there any asymmetrical or symmetrical chest strips, and then we auscultate the heart and the lungs. Then also on the breast, you can see if it's symmetrical, the left and the right breast. Is there any lump that you can see? Has the nipple, is that protruding or not? How's the areola color? Is there any colostrum, and is there any stria? Is it painful? Is it redness? And the loin, you can check if there is problem with the bladder, so we percuss and we touch the tenderness of the part of the body. Here in the pictures, you can see that there's like a little bit of striae on the mother's breast. And then we move on the extremities. We check the CRT, the capillary refill time, the deformity, is there any varicose vein, tenderness, patellar reflex. Abdominal, we see is there any scars. We have the linea nigra, it's like the one in the middle. We have the stria gravidarum here. And then we see if the abdominal enlargement is normal. Is there any abdominal shape? Is there any edema? Is there any ascites also that follow this? Then we do the Leopard maneuver examinations, and then we see the genitalia area in the vulva and vagina. Is there any signs of pregnancy, Goodwill? And then also we see the perineum. Is there any scars? Is it clean? So then that's how we assess the pregnant woman. Remember, on assessment, you have to also explain that in the beginning, the uterus will be small, and once the baby start to grow, you can see that the tummy become bigger, and it's also become even more bigger when it's reached the 30 weeks of gestation. So just remember this to help your patients understand that they're having changes inside their body because things are moving inside. So these are the reference. We hope that you understand what we are explaining. Happy studying!